I'm gonna give it a few minutes just to let people come in. But I know sometimes they take their time. Okay, well, welcome everybody. Thank you for joining us this evening for our second in the mental health and well-being webinar series that we've run this club season. So this topic is one that came by, I don't even like to say popular request because that makes it sound like a hugely positive thing, but it was definitely a well-requested topic about how to cope with injuries and support athletes who are going through the experience of being injured. And so I'm very excited to be here today to learn more about it. So just to introduce myself, for those of you who don't know me, my name's Emma Gibbons and I'm the CEO of Volleyball BC. And I'm very excited to be joined here tonight by Dr. Shaunna Taylor and Derek Thiessen, who is one of our mental health ambassadors. And we will be joined by Kyla Richey, who will be joining momentarily to also contribute their experience, which is amazing. So I'm very honored and grateful to be with you today from the traditional and unceded territories of the Tsleil-Waututh, the Musqueam, and the Squamish First Nation. Volleyball BC's head office is based in Burnaby, and so those are the traditional territories that we are grateful to be part of. But as everyone knows, we play volleyball across this province, and we are very, very grateful for the opportunity to do so. So without taking any more further time from this webinar, I would like to introduce Shaunna and hand it over to her to facilitate the session.
Thanks, Emma. I know it seems not like a great thing to celebrate that this was one of the most popular. It doesn't sound like it's a positive topic, coping with injuries, but I think it's an inevitability, right? It's a really important part of the sport ecosystem, is accepting that injury is part of the sport landscape. And so the more that coaches can be informed on how they can support their athletes, the better. So that's what this series is all about. And I'm very passionate about this. In my past role as chair of the Canadian Sports Psychology Association, this was often a really big part of my job, and for many years, almost 14 years, working in a sport medicine clinic, this was a big part of my raison d'être, as they say in French. And it's also an important part of some of the things we talk about at UBC in the coaching courses that I teach in the School of Kinesiology. I'm very excited to have Derek here with us this evening, and his colleague Kyla as well, because both of them are not just bringing their education, but their lived experience as former elite athletes throughout long careers. And now I'm finding out from Derek, multi-sport careers, also basketball. I'm sure he's going to talk a bit about that later as well. We have basketball in common. And it's really important because part of the genesis behind this whole program is also to get coaches thinking and talking about mental health and the interplay between the physical side of sport and the technical tactical skills, but also mental health and mental health literacy. So thank you for Derek taking some time out of your busy life and joining us tonight, and soon Kyla as well. If we're going to discuss what you'll receive tonight, hopefully for things that you can direct towards the athletes that you're coaching, but also for yourself and your coaching practice. We'll be looking at some concrete tools and some resources that you can source out afterwards, as well as some ideas. So hopefully take some notes and get a few nuggets that you'll be able to apply afterwards. We do know that injury and sports injury needs to take into account all of the realms in the biopsychosocial model. So the mental, emotional, and social elements, and they all have really big impacts, or they're highly impacted when an athlete is injured. So that's one of the first points on here. Also that the rehab itself goes through 3 distinct phases. And we're going to break up tonight's talk into those 3 phases so that you can learn a little bit more about what you as a coach can do to support your athletes when they're in each of these phases. Also, just just a statement of what I believe to be a fact is that mental training and providing this kind of mental health literacy really does render an athlete to be stronger, better long-term outcomes in all three of those phases. So onset, rehabilitation, and return to sport, if you know a little bit more about the things that you can be doing to support them as a coach. So the strategies are for you. These are some of the basics, but it's by no means a course on sports injury, but really looking at it from a dimension of what can you do to support them in that sort of mental, emotional, and social side. If there's something that we don't answer that you may have submitted in the survey that was given out for those who signed up for this, please reach out to Volleyball BC. I think we've done a pretty good job at answering as many questions as we could and integrating them into the content, but there may have been things that we missed. And even if you want to contribute live, that's one of the benefits of joining us live, is that you can add those to the chat box, and we'll try to adjust them this evening right away. So I guess to start off, just setting the tone of one thing that or 5 things that we know are true, 5 really key factors that affect athletes' ability to cope after they've had an injury are these 5 here on the screen. It's not an exclusive, or it's not a all-encompassing list. There are certainly others, but these are some really strong ones that have a big impact. So the strength of that support system around them. So how many people, and what's sort of the quality of support that athlete is receiving? What are the skills that they already have? So those might be from other elements of life or things that their family has instilled in them, maybe that you have instilled in them as a coach, or other means. But what do those coping skills look like? Also, what's the timing of the injury? Did this happen, at a peak time in the season? Was it in preseason? Was it postseason, or doing some other activity? So that can have an impact. Also, the degree to which your athlete has what we call hardiness. So how resilient they are, how they manage when they're given challenges. And then finally, what is their level of psychological flexibility? So how do they adapt when they're given circumstances that weren't necessarily foreseen? How do they behave? And it's tied in, I guess, with some of the coping skills and the hardiness factor. But these all have an impact on the speed of which they go through these 3 phases, but also maybe how they emerge at the end. And so we'll talk about that as we go through. We also need to define, for the purposes of this webinar, and it actually came to our attention towards the end, that maybe we don't want to just talk about sport injury. We also want to talk about illness as well, because athletes are, of course, going to contract illnesses, or they may already have a chronic illness, or they may have had an illness since childhood, and it's something that they're learning to live with. So there are lots of different dimensions that we need to consider when an athlete may have some physical, mental, and emotional challenges or barriers to participation. So in the physical realm, we have acute injuries. So these are the ones that happen suddenly. They happen while they're playing or while they're training. And then we have chronic injuries. So these are the ones that happen when you've played a sport for a long time and they start to crop up. And I think when it comes to illness, it's something similar. So you can have sort of the acute and sudden onset of a flu or something else, or even something life-threatening, or you have something that's chronic. So it's a condition. It may have been something that they inherited from birth that's hereditary, or something that comes on later. But either way, they need to be dealt with. They need to be provided support. And I think we can apply many of these same techniques and ideas to both realms, so both injury and illness. When it comes to injury, these are some of the phases when you're looking at it from a sports therapy point of view. And I've added sort of a caveat of a 3.1, I guess, at the end as well. But the first phase being injury onset. So this is when the symptoms are starting to crop up. So whether it's something acute or sudden, or perhaps it's something that's just being investigated and it's intermittent, it's coming back, but we're sort of in that onset phase. We may even not have a clear diagnosis even in this phase, but the athlete is definitely feeling discomfort. They know that there's something going on. There's some kind of impairment. So whether that's injury or even illness, right? The second one being, now we have an idea as to what it is. or we might not even know exactly what it is, but we have a certain realm or a certain approach that we tend towards treating symptoms in this suspected area. And in the rehab phase, there are very specific elements to a treatment plan that might be applied, and many psychosocial effects and aspects that we need to take into account. We'll talk about those. And then the third one is, once they are able to return to sport, what does that look like? So it's following the rehab, they're getting back onto onto the field of play. What are some of the things, the psychological elements that we might want to make sure that we're aware of and support that we can provide? I did just want to mention, just because this is unfortunately part of the reality too, and you as coaches, I'm sure, have seen this. Maybe you even experienced this, depending on what your exit from sport was all about. But there may be some athletes for which there needs to be some transition where it's really challenging for them to be able to get back onto the field of play. And so it may be that they're no longer able to participate in volleyball, but my hope is that we still are able to find a way to map it out so that they've got some other place, meaningful place, to put all that energy and all that talent so that they can continue to develop as amazing young people. So making sure that we have some kind of a transition plan as well. So that's a little bit of a 3.1, I guess, in a smaller group of cases. So to start off, we'll start with phase 1. So the injury onset phase, this one can be short or this one can go on for some time. But what we want to make sure that we do and we address right away is not just the symptoms of the injury and be looking at this athlete as an injury or as an illness, really as a whole person. So how are they viewing it? How are they absorbing it? And to do that, we got to talk to them. You got to stay connected with them and ask the questions and make yourself available. And many athletes are very open and upfront about that, and others are very hesitant to discuss when they have injuries. And sometimes the higher you go in the hierarchy of sport into competitive sport, the more we'll see the concealing of injuries as well. So that's something to really be aware of as a coach. I'm sure many of you already are. But because of that high level of athlete identity, it's so intertwined, it's inextricably linked with their sense of self. It's probably taken up a big, proportion of their time and their passion. There's a fear when they have to step away from it for whatever reason. So they can tend to go into distress pretty quickly and to some pretty low depths. So this is why you, as their leader and someone that they're going to look up to, will need to be in touch with that and aware of that. And the third point on here, just encouraging them to open up, of course, and getting support. And so maybe tonight is a first step for you to think about some different supports that you'd be able to have in your toolkit to be able to offer them once they are injured, because inevitably some injuries are going to crop up throughout the season. Other things in this injury onset phase, athletes should be listened to, of course, but also maybe you want to have some tried and true and some very experienced, if you have some in your stable of practitioners, physical therapists, massage therapists, sport medicine professionals, physios, etc. And one place to start, if you don't already know this, is Sport Med BC on their website. So you have many practitioners throughout the province that are signed up as having a sport specialty. So they're sport informed therapists as well. And so that would be like one important thing to have in your toolkit, is to have some referrals, have some ideas of where they could start. Some families get overwhelmed. Emma and I were talking about this, until your child is injured for the first time, you really don't even know who you would send them to. So as a coach, you can be sort of that support person to send them in the right direction of where they could start looking for someone reliable and experienced. Secondly, so providing that emotional support as their coach, but also the team support. So what can the team do, right? How can the team stay connected? How can we open those portals to listening, understanding, involving them in team functions whenever possible, inviting them to attend training, even though they may not always take you up on it, but making sure that they know that they are welcome. And a competition, for example, and encouraging them to consider both the short and the long-term effects, but also maybe even some silver lining of a well-managed injury. And I know that sounds like the farthest thing from a lot of these athletes' minds, is that this could possibly be some kind of gain from getting injured, but that will be a central focus of what we're going to talk about tonight. And I'm sure what Derek and Kyla will share as well. I also wanted to do, I can't believe I'm blanking again, Emma. I wanted to share the clinic that you've teamed up with who helped you come up with these great one-pagers on injuries. Can you please interject in my
I
apologies?
can, yes. We developed a series, I think there's about 7 topics on different common injuries that in conjunction with Kids Physio Group. So
It's
they help to develop these 2 pages that are very high level and provide an overview of the injury, signs and symptoms, and then really just some information about recovery and obviously an encouragement for people to go and find further professional support as they need.
Exactly. So whether it's, a new sport parent or a coach who's really new to being at the helm, really having this one pager, this is like a first step, and it's certainly not the last step, but this at least might get you in the right direction as you start investigating some of these symptoms that might crop up in your players this year. So we've got everything from finger and thumb sprains, obviously in a sport like volleyball, and rotator cuff tendinopathy, patellar tendinopathy as well. So knee issues, ACL tears, ankle sprains, shoulder dislocations, and lower back injuries. So this isn't a complete list, of course, but this is a well thought out list of some of the more common injuries that tend to crop up in the sport of volleyball. And another one to think about as well, while it might not be the first thing on everyone's mind, brain injuries or concussion, it is something that I think it's really important. And most of you as coaches, that it's important that you familiarize yourself with Volleyball BC's return to play protocols, which are also available on the website. But in particular, these 3 kind of key points is that if you suspect a brain injury or concussion, that player should be removed, right? One Hockey Canada team doctor who I respected so much and worked with for many years always said, when in doubt, sit them out. That was his rhyme. So he really liked that. And it's not just hockey, it's all sports. And then, of course, getting a proper evaluation and notifying parents, particularly if they're minors. So just a special word about concussion, because obviously as somebody that works with brains for a living, this is really an important area for me. And sometimes dealing with complex concussions and brain injuries becomes a big part of my job as well. So the earlier we can treat it and the sooner we can remove an athlete and get them properly treated in their return to play, the better. Earlier, I also talked about how you may want to discuss short and long-term gains from injury. Might not be what you're going to lead with when you're talking to an athlete. That's not going to be the first thing they're going to want to hear, is you with Susie Sunshine smile on your face after they've just had an injury. There's going to be a lot of stress, but eventually some of this perspective building can be a really important element that you, as an experienced adult in their life that they look to for advice and support, this would be an important message. So one thing that you could pass along, and I'd encourage you to read it yourself, is some articles that are out there by athletes, that some of them high profile, some of them lower profile, who talk about what injury did for them. So what it did for their growth as an athlete, as a performer, but even as a person. And one of my favorites is actually a 2015 article. So it's like a 10-year-old article now, but it's a pretty stellar one, from a US Olympic and national team soccer player, Brandy Chastain. And she does a really great job of talking about different setbacks in her life, including her injuries. And I just have a couple excerpts here that I think will give you a bit of a flavor of what it's about. So in her case, really centered on knee injuries. So 2 ACL tears and meniscus tears and surgeries that followed up, and how they kept her from the game, right? She talks about her letter is written to her younger self in the first person. So she's telling her younger self, and giving them the crystal ball of what's going to come in the future. And you're going to be out for 2.5 years. You'll have to be patient. You'll have to listen to your body. The time away is going to give you pause. And you're not going to be a starter. You're going to learn what it is to not be a starter and appreciate your teammates, carry on and cheer from the sideline for everybody else. And that they are going to appreciate you more because of that. And they're going to cheer you on as you work your way back into the lineup. So I loved that section. And I also loved this section too, that the mental and physical challenges of rehab are going to test your patience and that you have to have faith, redefine your perseverance, that you don't really know what's on the other side, but you have to trust the process, ask all the questions. And I love this section. You'll return a better player, a better teammate, a better person. So think about that. A well-managed injury could actually make this happen, right? So learning more about the details. She learned more about what it was to be an athlete, to understand her anatomy, to understand the holistic nature of being an athlete, be in tune with that, and to communicate those things. So it's not all bad news, but don't lead with that. I'm pretty sure you already know that, but don't leave with that. Hey, great, super, silver lining, things will be better. Yeah, probably not, but eventually that can be a very real truth. So keep that in your back pocket. And when you feel like they might be ready, that might be something that you would want to share. You may also want to encourage them as soon as possible to work potentially with someone else who specializes in this area. So someone who is a mental skills or mental health consultant in sport or a sport informed therapist. So a counselor who has some sport informed practice. Maybe they're an athlete themselves or has some specialized training. So this will really go a long way. You don't have to be all things to all people. You are their support person for sure, but there are specialists out there that could potentially be that extra layer of support to help them through this. So you could recommend that and get a few people as referrals in your stable as well. And I also, I feel like I need to start getting some kind of a kickback here for referring people to this book, but it really is that good. I use it a lot in my practice. It's a book on injury rehab from the mental perspective, from an American. Her name is Carrie Jackson Cheadle. It's actually a New York Times bestseller. It's very popular. It's called Rebound and How Athletes Can Train Their Mind to Bounce Back Stronger from Injuries. Boy, I wish I'd had this years ago, and for myself, but also earlier on in my practice. So it's a really great book. It comes with worksheets and all kinds of experiential things that athletes can do. So you don't have to be the expert, but you could offer these resources and let your athletes know that these are available. Let your families know that these are available. And there's also a really great aligned podcast that goes with it. So it's called the Injured Athletes Club, and it can create a sense of community. So maybe this is the only injured athlete on your team. So there isn't anybody else that can really relate and they're feeling really isolated. Podcasts are a really great way to multitask or just, during transportation, put their earpods in and listen to some of the podcast entries that might interest them. So she's got them all listed just like any podcast. There are different episodes. So your athletes could pick and see which, and I should have taken a closer look and see if some are done from the coach's perspective. I'm not 100% sure about that, but there might be some on how coaches can support athletes as well. These, I just thought I would give a couple examples of what some of the worksheets that you'll get when you take a look at this book and some of the resources that accompany it. I love this one. Recovery is now your sport is chapter 3. And you can see on here, she's got, what were your firsts? These are some firsts that now you're doing after the injury. Times you've demonstrated perseverance and resilience before. So making athletes think about times where they've persevered and gotten over other tough things. People that you're grateful for, things you're proud of, ways you feel you're becoming stronger, other wins to celebrate, and celebrate your progress. So little incremental beginnings. So giving them tools like this early on. So early on, they're already seeing, wow, there's reasons to be optimistic. There are tools that can help guide me along the way. I don't have to be alone. Other people have done this before, I think is really key. And so now I'm going to stop talking and turn to our two mental health ambassadors and lived experience experts in volleyball, Derek and Kyla, and I'll let you decide. I guess Kyla's not, maybe, sure, the camera isn't on, so maybe we'll start with you, Derek.
Yeah. No, I'll go. Um, yeah, I guess I'm thinking, I mean, is it worth sharing some ideas around like how this might apply for coaches, or is it helpful more even just from like my just purely my
Maybe
perspective?
a bit of both, like give your
Yeah.
perspective, but then if you can even think back through the eyes of your athlete self, what would have been
Mhm.
so helpful? Maybe your coaches did do it, but maybe they did.
Mhm.
What would have been helpful?
Yeah. Yeah. I mean, my big injury was when I was in grade 12. I tore my ACL and did that actually playing basketball, not volleyball. But it just remember again, like thinking back to it, it was just such a shock. I mean, it's just obviously not something you're anticipating at that age, and I think being young, you kind of have this real sense of like I'm never gonna get hurt, or especially if I think for me it was my first major injury, and so I think that was what really kind of like threw me off too, was I wasn't used to being out for so long. I think it was like, oh, you sprain an ankle and you're kind of back next week, or you sprain a finger and you tape it up and you're ready to go. So I think that for me, that real suddenness of it and just the longevity of the recovery was really hard. And just when I kind of initially found out, and there was kind of the initial phases of, is it this, is it that? It was just very long. And I think when you're that young, it can feel so like your whole life is just like it's nothing could be beyond this. So I think for me, yeah, it was again just like a very sudden in that initial phase, and I think there was a lot of the pieces around like instantly kind of just feeling like I'm on the outside. I'm one of the injured players. I don't get to practice. I don't get to play. Everyone's kind of doing all these things, and so I think that loneliness piece was one that I struggled with. And I think looking back on it throughout, the different teams I was on, so again, it was about a year and a half of recovery. So it was being in high school, then club, um, and then I was fortunate enough to have still signed with the university, so I got to go to my first year. um, it really it did help to have ways of like still bringing me into the team. I think that was really important to me, just to like give me a role, give me something to be a part of. Like I still would go to practice. I still would sometimes even be given opportunities to like do stats or just different things. Sometimes I was probably less open to that than other times. Sometimes I probably just wanted to kind of mope a little bit, but I think just the ongoing knowledge that like I was still of value, even though I wasn't playing, was really important to me. Because again, I think so much of us for athletes, our identity is tied to playing the sport. So when we're not, uh, especially because of something that's very much outside of our control, it can really feel, yeah, we're like on the outside looking in, and now no longer matter. And so I think the coaches that I had that noticed that, and or even teammates I had that noticed that kind of found ways to bring me in, was really something that kind of brought me through it all, but definitely in that early phase.
So do you think, Derek, even if maybe you don't take them up on all of them, it's definitely worth you getting the offers, right? Like even if
Mm-hmm.
sometimes it wasn't the right timing or it was a real struggle for you, just knowing that those options were there and that people were checking in with you and making sure to try to keep you engaged, that's still something that you'd recommend coaches do.
For sure. Yeah. And I mean, it's hard because some days I imagine I wasn't as receptive. Like I said, I wasn't as receptive. And, that's kind of that first, I mean, that first phase of, I guess you haven't done the FAR and now the FAR acronym yet, but there's just so many big feelings kind of going on in it all. And so like some days, yeah, I'm going to be really down and just like in the dumps about it and really sad and frustrated. And then other days I might be more like, okay, yeah, I can do this. And so the consistency of just like, we're still here for you, even if you're kind of one of those off days. Sometimes those are actually more important, just to know that you're not, oh, we're only going to connect with you when you're happy.
Yeah,
It's
exactly.
that
Yeah.
can be sometimes hard too, because some days we're not happy and it sucks.
Yeah.
And it helps to have someone who can still kind of meet you in that a little bit too.
Thank you for that. That's the thing, is consistency, and also even there's somewhere in the back of your mind, even though you're not accepting it on that day because you're in a mood, you know that it's there and it matters. Yeah, well, here's
Mhm.
that acronym
There
we
you
were
go.
talking
Yeah,
about.
perfect.
One slide later.
Yeah.
But yeah, so what Derek was talking about was in this phase 2 of injury. This is actually taken from the book that I was alluding to earlier. And just one of the general concepts that Carrie talks about in this concept of injury rehab is that your recovery becomes your sport for a lot of athletes. This becomes the thing that they're focused on now. So yes, they're still part of the team, but let's harness some of that competitive nature and that passion, and hopefully eventually some of that enthusiasm for understanding more about their injury and getting them through it through curiosity, but also some of these techniques. So going far in this injury stands for feel, accept, and recover. So the feel being starts out with really acknowledging and processing these emotions. Derek spoke eloquently about that the emotions were there were lots of ups and downs. There were some days where he might have been at peace with things and feeling relatively accepting or even optimistic, and then some days where you're just completely bummed out and it's really tough to dig your way out. But that emotional roller coaster and acceptance is part of being a human. And so this is one of those life lessons that we can hand to athletes as a coach and let them know that you're there for them no matter what mood they're presenting in, and giving them some tools to hopefully help them cope along the way. So feeling them, getting athletes to really feel it. And then the accepting part is tough, but we can't move forward in rehab without an acceptance, because once they've accepted and they start getting some of that guidance from the physio or whoever is the lead of their rehab team, then we can start moving in a direction where we're hopefully turning the dial on healing. I guess we could say the same for things like illness, making sure that they're taking care, if there's medication involved or there's rest involved. There's different types of protocols when you're recovering from illness or dealing with chronic illness. We'd be applying the same thing. So acceptance. And then finally, now we're in the recover phase. We've gone from the feelings and the accepting it. And now we're ready to get mobilized. So that's the FAR acronym that she introduces. And just a little more elaboration on the feeling thing. If your athletes do decide to work with someone who has counseling background or mental performance and sports psychology background, one of the places that they will likely start is getting them to embrace those emotions and understand them a little bit more, and maybe kind of get even okay with them. They're uncomfortable, but they're part of the healing process. They're part of acknowledging your humanity, right? Is the full depth and breadth of your emotions. So understanding that they come in waves, they crest just like a wave. They come and go. They go forwards, they go backwards. And even providing, I like to provide the visuals to athletes that I'm working with and making them understand that emotions aren't things to be feared, but the more they can understand them, the more we can maybe make friends with them and figure out how we're going to respond should we feel this way in the future. So not vilifying a negative or a low energy emotion, but knowing that that's actually pretty typical when you go through something painful like an injury, and a sudden stoppage of this amazing activity that you love. But when you're stuck in it for too long, we want to make sure there's some kind of catalyst to help them move out of it. So different ways to help them watch the wave. You can encourage athletes to reach out to someone at the onset. So, wow, like this low mood keeps happening again and again and again. Who does it help to talk to? Does it help to talk to someone when you're feeling like this? Would you want to talk to me? Can I refer you to someone? What could that look like? Maybe an athlete who's been through injury before. There's lots of different routes that you could go here. Hopefully, part of your job as a coach is building that open relationship with your athlete where you can treat them on a case-by-case basis and know that every day might be different and they might be feeling something different. You can show empathy. Maybe you even have your own history that you can draw from. Sometimes they like your stories from the old days, sometimes they don't. So just look, if their face glazes over, they're not taking it in, but you know what? There may even still be something that is being lodged back there. And it's like, you know what? My coach is sharing this because they want to show empathy, and they do understand. So I don't know. I think any way that you can show as a caring leader and coach that you're in it together, the better. Also, maybe athletes want to emerge and they want to take action, right? So what can they do? So this is where giving them goal setting, or maybe resources like the Rebound book, or suggesting the podcast, or someone with some training to talk to, or like Derek said, having another role, that might be something you may want to do. But one thing you definitely want to get them to move towards, two types of goals, I guess, or two different parallel but different goal setting elements, I guess you could say, is the goal setting for their return to sport and the healing itself, and then eventually when they get back in the lineup, some technical and tactical goals. But that's sort of a subset. For this purpose of goal setting, I'm going to talk in one or two slides down the road. We'll talk about different types of goals that athletes can have as they're working their way through an injury. Ideally, for the physical part of the journey and the emotional part of the journey, they're going to be collaborating with that sport medicine team. So whoever's helping them and guide them in that rehab process, that's important. But you play a really important part of that as well, because hopefully you're being communicated with, so you know where they are on that pathway and what is or isn't recommended at this stage in their rehabilitation. And you keep those lines of communication open with the athletes and their families. Also, the goal setting is kind of it's an education, right? This is a chance to understand holistic healing, anatomy, getting educated in different ways. That might include you, right? Maybe this is a new injury you've never even experienced before either. This is a new learning curve for you. So just taking it as it comes, the way that your athlete is, and this is an opportunity for you to understand more about a chronic injury or an acute injury, or something that's very sport specific or unique to volleyball, or maybe an injury that's very specific to a particular position. So lots of ways. Setting goals and understanding more about goal setting can help move them forward. Here's where I talked before about the physical therapy goals. So those, usually an athlete isn't going to set those alone. They're going to need their sport medicine professionals to help them with that. But other things like fuel and hydration, maybe they haven't always been particularly conscientious about nutrition or hydration. Well, now's a chance for them to take that on with more of a microscope. Maybe it's social goals. Maybe this is an opportunity to reach out to some of their friends, both in and outside of sport, and make sure that they don't isolate themselves, which is a very common tendency for some athletes when they're feeling really low mood or depressed. Maybe they're becoming the student of the game. You can encourage them to do some scouting for you, to go out and see, hey, there's this trend, there's a new offense, or there's a new technique that setters have been doing, or there's a new prehab that we should be including with our warm-up. Hey, why don't you look into this for me? So there's lots of ways that you can help encourage that athlete to be a student of the game, or the student of being an athlete, right? And you could be an agent in making that happen. Mental skills goals, of course, and we're going to talk about a few of those a little bit later, or just getting a little more balance in their life. That's what this pause of an injury can sometimes do. So there might be other things that they could catch up on or investigate while they're waiting to get back in the lineup. Here are some of the mental skills that they might want to explore that you can help encourage. So emotion management, we already talked about that. In past webinars, we have discussed the wise mind. So helping athletes to navigate those really strong emotions, and also that reasonable, very tactical, very problem-solving oriented mind, and being in the middle path thinking. And it's tough, especially for teenagers. This is the time in their life where hormones and brain changes are happening rapidly, and emotions are very up and down anyway, let alone in an injured athlete. So I think those types of skills, emotional awareness and management, and things like relaxation, refocusing, are all really powerful and important skills to learn at this age and stage. Are there other ways that they could support the team, but also the way the team could support them. So there are other roles that maybe I haven't even mentioned tonight that you can think of creatively, or maybe we can come up with when I talk with the ambassadors a bit in a few moments. How about their holistic identity? Are there other elements to that sense of self that you can encourage them to explore, especially if they're given kind of a, okay, you cannot emerge on the field of play yet. We have a definite hiatus here for a certain period of time. Is there something, is there a way for you to set them free, to not feel guilty, to explore some of those things while they're staying committed and connected to the team, so that they can have a sense of accomplishment in other areas? And then we'll talk a little bit later tonight as well about visualization, which is a really powerful skill for healing, but also for encouraging confidence and skill acquisition. Lastly, before I turn it over to the ambassadors again, just different roles, in particular, breaking these out. And I'm sure these are not by any means a complete list, but there might be other ways for them to contribute on your team. So think about maybe there've been other squads or other programs that you've been a part of that have integrated injured athletes in other ways. Derek talked a little bit about keeping statistics, for example, or maybe reviewing video or assisting in discovering new plays, being the social convener. That makes sure that they're centered in the social strata, especially if they are generally a more social athlete, and then suddenly this injury has taken them out of that role. This can help replace that so that they can still feel like that part of their personality can flourish. And then any other roles outside of sport they could expand on or catch up on schoolwork, because almost all of them, I would imagine, at the age that you're coaching, are students as well. So for that rehabilitation phase, when they're in the thick of it, I'm wondering, I'm going to put it to you, maybe Kyla, we're going to start with you, because we've got coaches on here tonight. What are some of the things that you think that coaches, when you're in that rehab phase and it's kind of the up and down, forward, backwards, what are some things that you would want coaches to know about your history and things that were helpful that coaches did, or maybe that they didn't do that you wish you'd had? Can you think of anything?
Yeah, so I mostly dealt with chronic injuries during my time as an athlete, especially the last decade that I played. But there was still a few at the beginning that, took me out for days or weeks at a time. I think the biggest thing is, especially with the chronic injury, I'll speak to that. It's really hard as an athlete to come to you as a coach and say, for example, my shoulder's flaring up again. We're at a 9 or a 10 out of 10. Like, I need to take it easier at practice today. Like, that actually makes me feel sick just thinking about it now. It's the last thing we want to do, like, we're there to play. We want to compete with our friends. And it's easier to push through an injury, which long-term is obviously not good for the athlete and can also affect your season that you're in now. You of course want your athletes healthy near the end of the season. So I would just really pay attention to the inclusivity of the athlete. I think you guys were touching up on just making sure that they're included in all of the things, giving them little jobs, little roles, even like the pre-game or pre-practice or post-practice, like chat or pre-game pump up, like anything like that, if they're comfortable, of course. Just like little jobs that I think can, make them feel special when they're probably feeling really isolated in that moment. But yeah, I think just the shame piece of, especially for chronic injuries, is pretty big. And it sucks for the athlete to have that and kind of to have to advocate for their own injuries, because of course, again, with a chronic injury, it's not often that the coach is like asking every day, like, okay, how are you doing? Can you play 100%? So it's the athlete that has to do that. So yeah, just knowing that it's really tough for them and trying to just maintain that safe space and relationship between the athlete.
Thanks for that, Kyla. That's great. So yeah, Kyla just really focusing there on, for her history, largely chronic injuries that went on for, a decade or more, right? Coming and going and managing that for the long term. Thank you, Kyla. What about you, Derek? What do you think for this phase? Right in the thick of the rehab, what do coaches need to know that would have been helpful, or things you'd want to share with?
Mhm. Yeah. I guess maybe I'm thinking, a little more about the recovery phase, but or what yeah, that would be the final phase, right? It's kind of
Yeah,
recovery.
well, the final phase is like actual like return, like when they're back on court. So what
Yeah.
about, they're still they're not quite there.
Yeah. Yeah, because I think that that's a crucial time in some sense, even to still finding ways to, again, sort of be involved and actually, like I'm thinking it's always injury dependent a little bit, but like finding ways that the athlete can be either part of training or like, like okay, even if it's an ankle injury, there's still room for pass. Like you can do passing or you can do free balls. Like someone has to pass the free balls for a hitting warm up. Can it be someone who wouldn't normally, it's just like little things like that where I think there can be ways to, and I think as the athlete, sometimes you can feel like, oh, I can't enter practice until I'm 100% recovered. And it's like, no, we can find some like things that you can be doing that either are helpful for the team or helpful for you. Just in terms of, again, for me, I was a middle or an opposite. So my passing probably could have used some skill, some work of just like free ball passes and kind of simpler movements and just getting used to like training those sorts of things. So I think that, again, when the timing is right, there's opportunities there to kind of, especially again, when those little windows of like, oh yeah, there's some growth here. Okay. And do you want to like capitalize on it a little bit? Is there some skills you want to work on? So I don't know, that's kind of one idea that comes to mind. And I think I got some opportunities for that, but probably could have benefited from kind of even more little moments of that.
So like a common theme between the two of you is just that staying connected,
Yeah.
making sure that there was something that you could do, finding something that you could do and collaborating with your coach to figure out what that was going to be right for you in that time.
Right.
Yeah.
Yeah. Yeah. Just another thing that doesn't kind of leave you feeling like you're on the sidelines forgotten. And it doesn't have to be this like, oh, I'm just throwing the athlete a bone type thing. It's like, no, it just actually something here to be improved too.
Yeah. You
So
brought up something great. I'm going to remind you, Derek, though, because I want you to say it again, just because in case they don't listen to the other webinar for
right.
just for athletes. But remember what you said about going to the rehab room and how you found that helpful.
Oh yeah. Yeah. Yeah, no, I was sharing about when I was in university and there was this rehab facility where all the athletes kind of came together and something about being in that space where I didn't feel very, I think when I was outside of that space and kind of just in my own world, it felt very isolating and very disconnecting. And so when I got to go to this place where there was other athletes from other sports with other injuries, it just sort of created this space of common humanity, the sense of like, okay, I'm not just that alone in this injured journey, but instead something that, yeah, a lot of athletes are going through and people come and go. And you'd see sometimes the same people, and then you'd see someone just leaving and you'd see someone new coming in. And it kind of just felt like it reminded you like this wasn't permanent, but it also doesn't have to be something you go through by yourself. And that for me felt, very encouraging and supporting. And yeah, kind of reminded me of just, yeah, a little bit in what I think in that Players Tribune article, or even that author too, there with her podcast of just like these places and spaces where you can just share about what you're going through and not even necessarily talking about it, but just that knowledge of like, all right, we're all kind of in this together.
Yeah, there's a soothing in knowing that. You mentioned in the last webinar, misery loves company, and it just does. It just does, right? And it's not because we're all trying to be downers together. It's that we don't want to feel so isolated. We want to find commonalities and know that other people have gone through this and other people have, gotten better and emerged even stronger in some way, right? So I love that. So whether it's encouraging athletes to go into, a rehab setting, that's very well versed in, they might not, if they're not a varsity athlete, have necessarily that same communal environment, but some rehab centers do have that, where they've got a bit of a gym to the side. You're going to see other people. You're going to know that you're going to be working with people that understand what injury is all about. That's what I think what our rehab center was like in Ottawa, where I worked for many years. So thanks for just reinforcing that, Derek. That's great. Thanks for both you and Kyla on phase 2. So then hopefully if you get most of the way through phase 2, at some point you get to the place where you're phase 3 and you're ready to go back on the court. In the case of chronic injury or illness, it's a cycle that goes back and forth between phase 2 and phase 3 that might be a little bit intermittent and unpredictable. So athletes often do have a sense of fear, a certain amount of fear in this phase. Even though they've been looking forward to it and counting the days and dreaming of this day, they're also potentially a bit anxious about re-injury. If it's an illness, about it coming back, about it getting worse. Maybe it isn't completely healed or cured, right? They might be afraid about underperforming. Will I not be able to be the same athlete that I was before? Have I lost time and I'm behind? And so all those fears, reassuring them that is normal, that is typical, that they feel those things. But again, just being that wise, more experienced human that can make them see that there are a lot of ways that they grew as well, and that you really respect and appreciate those things. One way to really encourage them is to have a gratitude journal or to have a training log where you're getting them to keep track of the things that they're looking forward to and the things that they appreciated, even in that time of injury. What are some of the things that you learned? And now that you're coming back, what are the things that you get to appreciate again? So if we're focusing on that side of the glass half full, that can be really contagious. So encouraging them to do that, but encourage the whole team to do that so that they're not the only ones. You could even make that a team activity as well. Or you could also, in this particular case, this is a group of athletes, so they're not necessarily all injured here, but they're all taking a few moments just thinking about what their role, something that they're going to accomplish before they set out into practice or before they set out into a game. They can put a timer on and just see themselves achieving whatever that is, whatever that role is, and making that part of your team culture. So it doesn't have to just be one athlete thinking about this. We could do this even as a team activity as well. And that can be imagery or visualization that's done like in that setting in a locker room or in a dressing room or right there on the court. Or you can encourage athletes as well, especially if they're working with a specialist that can help them make their way through healing for imagery for healing. This would be getting pretty specific and even seeing images online of what their injury looks like. Now you want to be careful. Not all athletes can have strong stomachs and maybe want to see what's going on in their surgery, but many, you'd be surprised how many are curious, and the more empowered they can get and more educated on the cool thing that sport medicine is going to be able to do to recreate them, that knee, the better. So, and one more thing that I mentioned in the last webinar that I don't want to forget is when we're talking about their injury, and if it's something bilateral where you've got two of them, you got two knees, and one is the one that's affected, we're not calling it their bad knee. We're calling it their new knee, right? Or their recovering knee. But just making sure that the language that we're using to describe their injury or their illness is something that's empowering and isn't adding more stigma to the injury. So imagery for healing can help reduce inflammation. There's all kinds of resources online on how you can use visualization for calming and doing all kinds of different elements. I've got a few worksheet pages here that can give you an example of ways that they can use their mind's eye while they're just integrating back and getting that confidence back. So skill rehearsal, absolutely, but it doesn't have to be just them. You could make this a whole team effort, but at the same time, those one or two athletes that are embedded in there who are recovering from injuries will definitely benefit, where you're running through skills and having everybody like that previous image of the locker room. seeing what they're going to do before they're heading out. Coping rehearsal, managing the emotions. So coping rehearsal and emotive rehearsal are very similar. So just here are some scenarios that are going to come up. No, you're going to be a little bit anxious about them, but let's go through or let's think about what that's going to look like, what that's going to feel like. You can manage it. You've handled stuff like this before. You can do it again. So 3 different ways. And then healing. I've talked about the couple minutes ago, just about the healing imagery, and they can get as specific or non-specific as they want to get, as graphic or not graphic as they want to get. Many surgeons, like, that's kind of protocol now. They give them their x-rays, they give them their scans, they give them a handout with a clear diagram so they know what's going on here. Many physios encourage this because a lot of the research shows that this can be extremely empowering and can even speed up healing and get athletes to really think about, I guess, how far they've come, the more that they know about the mechanics of their injury. And then the last one would be just using imagery along with many other self-regulation tools that are in some other resources that I'll talk about in a second to help them relax. And so this will help them also avoid re-injury as well. So these are just some examples. We already have some other webinars. There are 2 that stick out in my memory. One was on performance anxiety and another one with Derek and Kyla. We met last year and we talked, I think Shanice might have been on that one, about self-care and different tools for just relaxing and managing stress. So you'll see a lot of these techniques will be in both of those webinars. So you can go back, and there's some tools as well, right, Emma, that are available on the website. If coaches don't already know about them, they can just go on and download some of those.
Yeah, they're all on the Safety Hub as under the mental health and well-being.
Right. So just a reminder that them coming back, it's okay to be, and it's quite typical to be nervous, to be anxious, to be a bit fearful. But when we play tense or we play tentatively, and we do that chronically, we can often then get compensation injuries where you're trying to make up for it by being extra gentle. And it can cause lots of issues with things like competence and confidence. So just a few other resources I wanted to remind you all that you can also look up. Another adage, I guess, or a perspective builder, and this isn't just for the injured athlete, I think this could be for your whole squad, is this statement of good news, bad news, who knows? You know, so it's kind of a neutralizing tenet from Zen philosophy that, you know, we could use this injury and all this journey that they've been on as bad news, or it could be good news, or it could be who knows. It's really all about perspective. So just making them see that there are lots of different ways to spin just about anything that life throws at us. And you can use that kind of philosophy with any kind of obstacle that's coming up on the team, whether it's some isolated injuries that are happening or some other kind of performance setback. But I think the more we use these particular moments and challenges that our athletes are going through as global kind of human and life lessons and growth opportunities, the better. Because sport isn't just about sport, it's about building life skills. I guess at this point too, I'd like to turn it over to the ambassadors to think about, once you were back on, you know, just getting back onto the field of play as you'd had that sort of rehab journey, whether it was chronic or acute, what were some of your memories that you had about being back on that field of play? And what was helpful from the team or from the coach once you got back in the lineup? Anything that you'd want to share? I don't know, Kyla, if you want to start.
Yeah, I think I talked to the athletes just on the last webinar that I also felt, especially after like being away for multiple days or a week or more, it is nerve-wracking coming back to the team to practice. You're just out of the swing of things, whether that's the social aspect of volleyball, or B, if it's also the skill set. You know, every practice is really important, especially for these short seasons. So you could be far behind when you're going back to practices. So I think for a coach or as an athlete, to hear a coach just, you know, reaffirming everything that you were doing during this time that you were off the court. So whether you had new special jobs with the team and just reaffirming that they're just as much a part of the team as anybody else, whether they were just rehabbing or whether they were playing this whole time, that, you know, they were working hard and just, yeah, I think affirming that player to continue to give them confidence. I also think it would be, you know, amiss to assume that the player would just be jumping back in and to kind of, I would say, like, treat them as though they didn't have that injury. So again, like picking up positive things that they were doing in practice. I'm not sure if they'll be passing 3 balls right away, right on their first practice back. But you know, just saying like, I loved how you moved your feet here. You got your platform out nice and early. I liked like watching you interact with your teammates and cheer, and you really were bringing up the energy in practice. Just again, any little thing I think is going to be really helpful because they're already probably feeling pretty worried in general.
Yeah, they're feeling tentative. Like those words would be powerful coming from a coach.
Yeah.
Yeah. Those would have been the kinds of things I think I would have loved to have heard. Thank you, Kyla. Those are awesome. We're just getting better as this rolls along. We should do a third version of this, Emma. We're getting great ideas. They're
Maybe
just
not tonight, but yes.
tonight, maybe. Get a little late.
Three
How about
times.
you, Derek? Are you still pulling out gems, Derek? Even though it's fine, even though it's 8:30, you still pulling out gems?
I don't know, we'll see. Yeah, I mean, I'm thinking way back when, you know, what that was like. Because I remember I have this very distinct memory of coming back and doing this. I think I must have been maybe 8 months post surgery, and 6 to 8 months is kind of when you're supposed to be like better, or you know, just, and I think like you can just get in your head a lot with like these expectations around timelines and stuff. And I remember doing like a kind of just doing my first like spin serve in a while, and my knee kind of feel like it got a little tweaked again. And I just remember feeling so discouraged in that moment. And I had a teammate of mine who was just kind of really supportive and like kind of saw that that really like was hard for me, and I think which is very like encouraging in that moment. And I think it's just like that piece of just being mindful of where that athlete might be at, and sort of, yeah, I guess just, I don't know. I'm sort of struggling a little bit with what that I think. But again, it's just like the bit of that needing someone to kind of just be supportive of me in that moment was really helpful, and being prepared, I guess, for some of those like little setbacks and stuff. So I think maybe once someone gets out there, there can be this, okay, it's going to be awesome, and you know, I don't know, like, and I think just having someone again who was mindful of like those little minor setbacks was helpful. And I was going to say something else, but it escaped me.
Well, you were on a roll. You're on. We just don't know what the final roll was, but we knew. I love
He's saving it to the end.
He's saving it. He's going to be a zinger. It's going to be right before we head off, and he's like, oh, I remembered what it was.
We'll see.
But yeah, I love.
I'll say something again, Shaunna, just going off of Derek. I have a national team athlete that broke her knee, everything in it, and yeah, just going off of that like specific timeline from like coaches and staff, you know, they're asking her all the time, like, how's rehab going? Okay, when are you going to be back? When are you going to be back? And like, it did put a lot of pressure on her. And I think like Derek, as you probably felt like, okay, now it's time. I'm supposed to be better. So I'm going to try to do this, probably something that I shouldn't be doing because I'm not really listening to my body. And then, you know, you hurt it further. I think, yes, there's a timeline that it could be like, you know, the average, but again, so many athletes and bodies are so different. So you can have that maybe in the back of your mind, or whenever a physio or doctor has said that, you know, healing time is supposed to be, but I wouldn't be continuously talking about that with the athlete just in case it's an extended timeline. And yeah, I would again just avoid that like pressure to come back as soon as possible, because of course they're already wanting to do that.
Yeah. Yeah, I'd agree with that. Yeah. Oh, I think the thing I remember too is, which ties into that a little bit, is just like finding ways to celebrate like the small wins. Just those little like moments of like kind of getting back to this and that. And yeah, I think because yeah, sometimes it can feel like, oh well, that's not enough. I'm not here. I'm not back 100% to where I was. And it's like, you know, that if that's the only thing we're able to celebrate is when we're back to some like arbitrary moment, you know, we're missing out on all like the little points of growth along the way, which I think kind of ties into the bigger importance of like injury recovery in some sense, is the value of going through that and the resilience you develop through that. Because that was a big thing I took away also into my character in some sense from my injury, was I became a more resilient person because of that too. So I think being able to see the little stuff along the way is important as well.
Well, and I even feel if I could possibly jump and make this link between the two of you and your injuries and the fact that you're ambassadors now, but like you both just have a boatload of empathy and you're both just so passionate about helping other people. I can't help but think maybe some of those experiences laid the foundation for that. You know, probably other wonderful reasons too, but I mean, it's just part of the kaleidoscope that makes you you. And hopefully that even talking about this tonight makes you see the links, you know,
Sure.
of
Yeah.
your awesomeness. Yeah. So thank you. Thanks to both of you for that one, for making those links in that sort of return to play. We've got to be patient, having those black and white, very structured, presupposed deadlines and timelines, that we have to be flexible, right? And celebrating little wins, all the little wins along the way. So that was essentially, that was all we had prepared for tonight, for the 3 different phases and some of the bigger considerations about perspective building. Tried to integrate as many of the questions that we were provided in advance by all the coaches who gave some really great questions. So hopefully we've answered most of them. I don't know if there's anything, Emma, that was submitted to you that we've missed, or have we just
no questions, but a comment from one of the participants just talking about how, you know, it's, I guess, a challenge, but also the opportunity for the coach not to make the athlete feel excluded, especially when they try to come back too soon from injury. So I think that speaks to the, like, sometimes it's not a linear path and your role changes.
Exactly. Thanks for that. That's absolutely true. So
Yeah.
hopefully you got some ideas tonight about how to navigate that for now and the future. But thank
Yeah.
you. Great comments.
Absolutely. I think it really just remains for me to thank everybody and for attending tonight, and also to thank our 3 amazing presenters, and to let you know that we will be sharing this recording, because I've had lots of questions about that, and the links to the registration for the next session, our next and final session in April, which is always a popular one, and that is how to prepare your athletes for performing at provincial championships and managing performance anxiety and all of that good stuff. So I will be sending that out to everyone. If you haven't registered already, you will get a registration link for that one, and we look forward to seeing you in April. So thank you, everyone, and have a good rest of your evening.
Great. Thanks, everybody. Bye. Thank you.
Bye.